Assalamualaikum warahmatullahi wabarakatuh, and a very good evening to all our viewers. Welcome to Urgent Spotlight. My name is Azrul Khalib. This is the 7th session in a series of online talk shows where we will be covering how the various policies and actions implemented during this period of the COVID-19 crisis have impacted today's urgent issues related to workers' welfare, refugees, education, indigenous people, migrants, and for today, we will be talking about women. The agenda for Urgent Spotlight is policy reform and holding the government, policy and decision makers, and yes, even you, members of the public, accountable. We are broadcasting live every Tuesday and Thursday at 8:30 p.m. via the CSO Platform for Reform's Facebook page. Today's topic discusses women's economic realities post-COVID-19, regressing or resilient. The past 3 months has been tough for many of us, particularly for those living in lower income households. We are now in the Recovery Movement Control Order, which will last until August the 31st. The bad news is that there is no such thing as a post-COVID period, at least in the next year. The hardships we face today and those that we faced in the past could continue on for much longer. Women face greater risks of infection because they make up the majority of healthcare workers. They're physicians, nurses, midwives, community health workers, and pharmacists, and they are on the front line caring for people who have been infected. However, due to pre-existing gender inequalities, women also face greater risks and mortality during emergencies and crises. Female workers, including migrant workers and those working in small and medium businesses, have lost their livelihoods. Despite many coming from the lower income bracket described as the B20 by Khazanah Research Institute, having no financial or social safety nets, women are bearing the brunt of the pandemic's social and economic impacts, including here in Malaysia. Women and girls shoulder a disproportionate burden of unpaid care and domestic work. In Malaysia, they spend more than 3 times as much time in their work than men and boys do. And this has increased significantly during the MCO, CMCO, and even the RMCO period, as they are now caring for children, ill family members, and the elderly. It is a harrowing time, especially if your job security is threatened, you have limited resources, and your savings are dwindling. This evening, we are going to be doing something different, where we have 2 speakers to help unravel the issues and clear the fog of the discussion that will be ahead of us. We have with us Irene Xavier of Friends of Women Selangor, or Persatuan Sahabat Wanita Selangor, and Maria Chin Abdullah, Member of Parliament for Petaling Jaya. Irene Xavier is co-founder of her organization and is a labor and human rights activist who has been organizing women workers since 1978. He is co-chair of the Labour Law Reform Coalition, which is endorsed by 58 trade unions from various sectors and worker organizations. Maria is a women and human rights activist who was chairwoman of Bersih 2.0 from 2013 until 2018. She was a founder and former chairperson of All Women Action Society, or AWAM, and was also the former executive director of Persatuan Kesedaran Komuniti Selangor Empower. Maria became the MP for Petaling Jaya in the 2018 general elections. Maria and Irene, welcome to the show. Glad to have you with us.
Thank you. Assalamualaikum and salam sejahtera.
Thank you. Welcome. For viewers out there, please do send your questions, and we will try to get your questions answered by our two speakers here this evening. So without further ado, let me start the ball rolling then. So first question goes to Irene, and how has the COVID-19 crisis affected women from low-income households, particularly those living in the B20 in areas that are of lower income, such as Kampung Medan, and how did they cope with the restriction of the MCO? Go ahead, Irene. Your mic is muted, Irene.
It has been a very difficult time for women, particularly from the B20 group, because of many factors. Many of them have lost their jobs during this period. Many of them lost their businesses, and the rest of the household also was staying back at home. People were working from home, or they had no work at all and they couldn't go out. So the brunt of caring for the family during this time has fallen squarely on the shoulders of women. I think it has been a very harrowing time for them.
Maria, places like Kampung Medan fall under your constituency, and you as a member of parliament would have been very much in the front, seeing how COVID-19 has affected them in these areas, particularly those who are not in the middle income category. What kind of experiences are you seeing facing women and girls as a result of COVID-19?
Thank you very much. I think that just to sum up, there are three key issues facing people. It's not in Petaling, Jaya. It's not just Taman Medan. It's also parts of Sri Satya. Maybe you all have heard about Lembah Subang, where income, work, and food security, these are the three key issues that are really a big challenge for most of them. And given that when we first started with the MCO, it ran into 3 months, that was tough because it means no job. Some have been thrown out of job. Some were promised half pay. Some were actually, living on very, very little. Despite the fact that the government actually initiated the Bantuan Prihatin Negara, it didn't quite help because with 1,800, the people were able to only spend on trying to pay for rental, water, electricity, and so forth. Yeah. So and the burden on women is I don't want to sound biased, but it's really double, if not triple, because being single mothers looking after several and having several mouths to feed, that's a tough challenge. And if you look at the statistics, the economic growth has not gone up, 0.7%, the latest from the statistics department, and the unemployment rate for women is 3.74%. That is it's not a double digit, but it's an increase from 2.6%. So it shows that women are hit by the post-COVID-19, and my worry is that despite the stimulus budget that the government is putting out, 250 billion, I really hope that it will be well spent and reaches the people who really need it.
Maria, you spoke about the BPN. Basically, you're looking at low-income households who would be able to get the full amount of the BPN, which was what, 1,800 ringgit?
Yes, about that.
Yes, and you would assume that because they were in this category and probably BSH recipient, they would also be able to qualify. Now, the question that a lot of people have been asking is whether or not this money actually was able to be received, one, and two, how has the expenditure of this money been? Because 1,800 was supposed to last for a couple of months, and
Yeah.
obviously this was something that people were supposed to be able to utilize. And when you talk about women who are basically head of households, especially in this regard, was the money able to be received by them?
Unfortunately, not everybody gets the 1,800. To be honest, I even got it. Can you believe it? Some of us got it. So I really question what is the criteria of this BPN. That's one. Two is that when we check, I'm just talking about people in Petaling Jaya. When we check, some are not, some who deserve to be on the BPN don't get it at all. They are not even registered in the list at all, because now you can actually check, yeah, with your IC and all that. But even with 1,800, the payment didn't come in March. The payment came late April, May. And so March, April, you have people who are actually not able to put food on the table. And you have people who have to pay for gas, electricity, water, and so forth. So when the money comes, they actually pay for these rather than the food. So by the time, yeah.
Let me get Irene's perspective here. People were not moving. People were not, going about their usual activity. And the argument was that people would not have to spend as much. Was the 1,800 ringgit enough for, especially to help with the expenditure of households, Irene?
From what I have heard from the women, it was not enough because prices kept going up. It was not easy to go and buy things. For example, if you are a woman and you had nobody else to take care of the children, then it's very difficult for you to leave the children at home and go out and shop. So they had many, many challenges. So that 1,800 was not enough. So people had to actually budget, had to eat very simple meals, and try to stretch that 1,800 as far as they could. In fact, many people actually started calling us to say, where else can we get food? I think our food will run out soon. So we had to source food for people, and there were many people who were giving out food in mosques and in different places. So we had to tell people, go here and get food, and actually arrange for distribution of food, because I think this is the first time that I have seen in Malaysia, Malaysians looking for food, afraid that they will run out of food. So the 1,800 didn't go very far.
Do you agree with the issues that were raised by Maria a moment ago concerning issues or concern regarding job security, food security? You agree with, obviously, and also the inability to actually bring in the kind of income that's necessary for their households. So is this something that you in your organization saw for women who reached out for help from your organization?
Yes, there were many women who were not paid. Some people were not even paid their February salaries. And then there was no place where they could complain. The labor department was closed. The so-called hotline in the labor department was not very accessible. You couldn't reach them. So people had many difficulties.
So one of the things that we were worried about was that there were a number of outstanding issues that exist before the MCO period that were newly identified or even worsened as a result of the confinement. And a number of issues were identified there. What did you see from your perspective that were new to you, that you've never seen before, but emerged and affected women as a result of the MCO?
I,
Irene, sorry.
yeah. Before the MCO, I mean, women were already on the not on equal terms with men where jobs were concerned. We actually have seen that there are many sectors of work in this country which are basically feminized, like for example, cleaning services, domestic service, contract work. All of this has a very high degree of women in them. And these are people who are paid very precarious kind of salaries. They like for example, you may work on the minimum wage for about 9 years, 10 years. There's no wage increments for you, no bonuses, nothing. So this is the reality that women were facing before the MCO. So women actually tried to look for other sources of income, sell food in the evenings, do some sewing at home. So they were doing all these sort of things. And of course, with the MCO, that little that they had, they also lost. Domestic workers couldn't go back to work. If you are not a live-in domestic worker, you can't go back to work. If you are a live-in domestic worker, then your hours of work increases, your workload increases because the whole family is there. And so it was a very, very stressful time for live-in domestic workers. They had no
Maria, maybe I can just ask you to pick up on some of the points that Irene mentioned just now, especially when we're talking about women having to work in what would arguably be vulnerable situations, especially if you're working as a cleaner, as mentioned by Irene just now, in hospitals, for example, or even some of the maintenance work for our public facilities, and there's a disproportionate number of women who are involved in that. What kind of assistance was actually able to be provided for individuals like that, including people who were homebound, domestic workers who, were now forced to work longer? What kind of assistance was there?
Not much, I believe, except for those who are in the hospital. I guess the government gave some support in terms of the children and the families. But I think that during the COVID period, there is also other groups of people whom I never expect that would need food, particularly the small traders, because I do have a food aid program at my community before the MCO. But I discovered that eventually we had to actually look for food to feed the small traders because they lost their business, whether they are by the roadside or they are in malls or in marketplace and all that. They have actually completely lost that source of income. We had to actually find food for people, the elderly. Really, in Petaling Jaya is an aging population, and quite a number of the elderly are on their own. They're staying on their own, put into units in a bungalow house, and it's quite pathetic living condition. We had to also feed these people. So a lot of people that I never expected, that we need to actually find food for them, were quite badly affected, particularly women. And especially when you are the female head of household and you can't go out to work, you are the petty trader, and you have like some families have even 7 mouths to feed. Oh, that is really tough on them. And that is something where I felt the government was not very sensitive towards these categories of people. They feed the general, but then they forget that you have petty traders, you have small little
Oh, but
uh,
Maria, what should the government have done instead? I mean, the government put
I
out a
mean,
stimulus package. It provided the BPN.
yeah,
What should they have done?
all good and fine, but they have to make sure that the money actually, or food or whatever, reaches these people. And it shouldn't be like NGOs frantically getting sponsorship and finding food for these people. The government should have played a much better and bigger role. Like for example, the under the women's ministry, they were supposed to give out those food baskets. We don't even know each parliament how many food baskets were allocated, who gets all these food baskets.
Until
Even there
today.
was the issue of the cost of these food baskets. Everything. I mean, you can have food basket, but make sure that you have a clear criteria that people who need it actually get it. We have
So let
reports where it goes into some people getting it like 2-3 times as compared to people who don't get at all.
so let me ask you both, Maria, if you were to give a grade to the Ministry of Women and uh, Community Development, A to F, as to how they performed during the MCO, what grade would you give them?
A to F.
Yeah. A excellent, F fail. What would you give the ministry?
I would just say F.
F. Wow,
I'm
that's
sorry
harsh.
to say that. Yes, I'm being very I'm very frustrated. Petaling Jaya, probably because we have so many NGOs and that cushions off the reach, yeah. But in other
Okay.
areas, that food basket is not reaching the poor. So
Irene,
at
your
just
grade.
Petaling Jaya, yeah.
Yes,
Yeah.
I
What's
agree
your
as
grade,
well.
Irene?
I would also say F because we were receiving calls from all over the country, from people that we didn't know, uh, people in plantations, many women in plantations. Uh, they didn't get the Prihatin package, and they had no food, they had no jobs. So I think uh, the government didn't really, uh, what shall I say, didn't really respond in a very positive way, or they were not very efficient in the way in which they tried to reach out to people. And the Ministry of Women created many other problems as well during that period. Like they shut down first, they shut down the helpline for children and people in trouble. We had to tell them to go and reactivate the helpline. I mean, a minister in this shouldn't be doing this. Yeah, so we
Uh,
had.
Let me ask you, Irene, do you think that the reason why the system failed basically to help women in general was because it depended on women being in formal sectors of work, but could not really adjust to those who were in the informal sector? So if you were in the formal sector, you paid your taxes or at least were registered under the BSH or in LHDN, you could benefit. But if you didn't have all that, and you were part of the informal work sector, you weren't registered. Do you think that's one of the reasons why it failed?
Yes, I think the government was a very active force to informalize work. It is the government that made the hospital cleaners private. They privatized them. When formerly they were permanent employees of the health ministry, suddenly they are privatized. So the government itself actually still is promoting precarious kind of work. The government is promoting work that is at the highest, at the minimum wage, and in many cases much lower than that.
Okay.
So I think it's a way of thinking. Their economic thinking itself is faulty.
So let me go to a different topic that emerged quite significantly during the MCO period and still is an ongoing issue. Women and girls are facing greater risk of violence during at-home isolation, lockdowns, quarantines, and curfews, which are being put into place to stem the spread of the virus. Now, during the MCO and CMCO, there were reports of the incidence of domestic violence was going on the rise, and yet at the very beginning, initially it was denied that this was happening by the Ministry of Women, Family and Community Development, but later this was confirmed via the ministry's own Talian Kasih hotline, which saw a 57% increase from women in distress. So my question to you, Irene, what was going on and what do you think was able to be done to help those who needed assistance during that period?
Well, this is not something, when you talk about domestic violence, it's not something that only increased here in Malaysia. It was a global phenomenon. It is quite unfortunate that if you live with a partner who is violent and you're forced to spend the whole day with that partner because he's not going out to work, then naturally you are increasing the risk of domestic violence. And I think that is what happened. I don't know how we could have prevented this, but really it became very clear at that time that women who were in trouble didn't have shelters, didn't have places where they could go to. Some of the shelters were not operating or they were already full house. So these kind of services, which are, I think, emergency services, just like the police and all that, they are there working all the time. But things like this also should have been available, and it was not. I think that is one of the things that they could have prevented. They could have set up more shelters, in fact.
Okay. Maria, what do you think? How was the response in dealing with the reports on the increase of intimate partner violence, domestic violence during that period?
To be honest, I don't think they deal with it very well. Like what Irene said, they stopped the line, the child abuse line. But you see, every day, if we look at our handphone, we have MKN sending us messages. Some of these social announcements could have been sent through the SMS. And every day we have this minister updating to all of us on the COVID-19. There could have been advertisement after his talk or before his talk on how to actually reach out to some of these women who are facing violence, children who are being abused and all that, so that you have a phone number and also to have instructions to the social welfare department that they can actually intervene when they have this kind of phones. But these things are not done. So they may talk about, they suddenly found that they have increased in terms of the phone calls, but they could have actually reached out to the women rather than wait for them to call them. I think that more could have been done. It's just that the government has not looked into these issues and just focus on just the food. And just even the food itself, they, instead of giving food baskets as support and all that, they could have given each those who fall below the minimum wage monthly wages, monthly allowance. Yeah, Spain and US have done that. I don't see why they can't do it and save a lot of stress
But
on
let me
everybody.
ask you, both of you, one of the things that we saw during the MCO was this reliance on a formal structure, meaning the minimum was that you should have an IC. And a lot of people may not necessarily have an IC, for one thing, and not even registered in the system. And we know that a lot of households, especially those are headed by women who are single mothers or who are of those who are destitute even, are not in the system. So where were they in the MCO, especially when you're looking at domestic violence? Did they get any assistance at all? Go ahead, Irene.
Yeah. Clearly, those who are not citizens did not get any assistance from the government. The only little bit of assistance they got was when there was a complete lockdown and they couldn't go out of their houses. Only at that time did they get some kind of food aid. But all other people, migrant workers, refugees, did not get any kind of assistance from the government, and the government said that they were not going to give any assistance to them. They were only giving all this aid to Malaysians.
Citizens.
Yes, citizens. And
Maria,
yeah.
So Maria, do you agree with that? Because basically there was an overemphasis on citizens, and we know there are a lot of women who are non-citizens, but also women who themselves are not. They are citizens. They just don't have ICs. So
I think that definitely, if you, whether it's BPN or the food baskets, you need ICs and you need to be Malaysians. But in my Kawasan and all that, I think that we have gone above that, gone beyond that. I give out to migrants to, we don't even bother about ICs. Yeah, I mean, it's just a piece of document. We don't bother about ICs. As long as you say you need food, you get food. So, but I'm lucky because in PJ there are so many NGOs. I don't know how other areas are faring because other areas are I don't know whether they have food to eat and who is supporting them because definitely where migrants, refugees, whether you are documented or undocumented, you don't get any support. Yeah.
So your approach in your area, it was a humanitarian approach, and that was the emphasis, right? So, we have a question from a viewer here who's asking, should the government have worked together with the NGOs to actually strengthen the response? Because initially, the government was basically saying, we're doing everything, every aid must go through the relevant ministry. NGOs are not allowed to do it because they could get infected, etc. But you just indicated very clearly that the government's not able to do it fully, and that the NGOs are in a better position. Do you think that there should have been a partnership when it came to this MCO? Irene.
Yes, definitely there should have been a partnership because I work in Kajang, and just like 10, 15 kilometers outside of Kajang, there were people, there were communities of workers who had run out of food. Their employers were not in sight. So where do they go? So there was no one reaching out to them. And finally, they found NGOs to sort of help them. And the government was still saying, no, you must go through us and so on. If we all had listened to that, then many communities would have starved during that period. So I think there must be a better relationship, especially when responding to crisis.
So I get a sense from both of you, especially, you're again emphasizing on food, and it sounds like food security was the prevailing issue throughout this whole period, and perhaps even until today. But, I'm asking also about domestic violence here. Was there any form of assistance able to be provided, shelters, as you mentioned, Irene, that was able to be given to those in need of shelter who were trying to escape a incident which endangered her life? Was there any possibility for help to be given at that period?
As far as I know, the chances were very, very slim. Women who faced domestic violence just had to stay in the house. They couldn't go out. They couldn't call for help. Nobody was reaching out to them. Most of the JKM officers were not functioning at full. They just had 1 or 2 officers working, and they couldn't cope with all these calls. So I think the government didn't really think that this was a very big problem, maybe. They thought, well, domestic violence is not really such a big problem. And I think that is because this is a woman's issue. Woman being beaten is not considered to be the top priority of the government.
Well, Irene, that is quite a stern rebuke to the government there. And I would like to know whether, Maria, you agree with it.
I think that is related to the system, It's not just about this COVID not being able to reach out. It's a system which have actually not been able to cater for a lot of these social problems. Yeah. One is the JKM. A lot of responsibility are put on the JKM. They cover from old to young. So, and they are so understaffed. So if you expect them to come out and solve all the problems, that's not possible. And that is related to the structural, it's a structural problem that we have. And the ministries all need to really review that properly. It's the same as, okay, I just give you an example in Petaling, Jaya. I must say that although I give F to the Women's Ministry, but we work very well with the JKM. Yeah. I gave the F is because overall other places couldn't get the food basket. But we actually set up a WhatsApp group with the JKM to actually monitor who are getting the food baskets. But what was interesting is that when we had a review, we found that, the JKM were not able to function as social workers. Eventually, they were seen as having to deliver food baskets instead of trying to rescue women or rescue kids who have been sexually abused. So there is a problem somewhere that has to be reviewed, and it's also reflecting the system. Yeah, the present system is not coping with the social problem, and I always feel that the women's ministry has got too many social problems bunged into them for them to resolve, and they just cannot cope.
So, one of the things that we've pointed out during the RMCO period is this hundreds of pages of SOPs that needs to be complied with and needs to be adhered to. And if you don't, you can addenda, and and most of these things are actually intended to help protect people from getting infected by COVID-19, but it's also intended to help people in terms of how to adjust to the new reality that we're facing right now. But I'm curious because right now both of you have identified a huge gap in the SOP of dealing with issues like domestic violence during a period of crisis and humanitarian concern. And definitely, don't you think this is one area that perhaps you could work with the ministry to help address so that it doesn't happen again? Because we're going to be facing this in the future. We're going to have perhaps another lockdown if it does happen to that, and we could be facing this again. So do you think you're open to working with the ministry and trying to provide some level of guidance or help when it comes to this issue?
Definitely, definitely. If they are open to it, I definitely have got a lot to actually present to them. And I feel, Azrul, it's not just about the domestic violence. I think that the whole care economy in our system has not actually worked well for the underprivileged and the marginalized. They actually marginalize um, quite a lot of people, not just about B40. They marginalize the senior citizens, the OKU, and this has to be looked at in totality.
One of the key points has been the emphasis on not leaving people behind. And we hear that a lot. We heard it from the Prime Minister, we heard it from the Director General, we heard it from the different ministers. Irene, if you wanted to talk about women, who was left behind when it came to the response to COVID-19?
I think women who took a very big share of the care economy were certainly left behind because they had no more care for their children, no more daycare, no more nurseries. So they had to take care of all of this. And at the same time, the rest of the family also needs attention. So it became a very, women really had to work hard. They worked hard in the care economy, even though they had lost their jobs. So it didn't mean that because they had lost their jobs, they could just sit in front of the TV and put their feet up and watch TV. That was not what the women were doing. They had to handle the children. They had to keep the children safe. They had to feed the children. All of this they had to do. So I think on the whole, the community that was left behind are women. The migrants were completely left behind during this period. Refugees were also left behind. Many refugees were being asked to vacate their houses because they couldn't pay rent. So all of these, nobody really looked at them. How are these people going to be helped? How can we stop these kind of things happening to people? Yeah, so
Maria, what would you have done differently? You're a member of parliament. I mean, obviously, MP would have a little bit of a voice, but we didn't hear that many MPs' voices who were highlighting some of these issues during the MCO period. Some of you actually went to the ground and were seen working, trying to provide assistance, and that was really good to see and provided a lot of inspiration for many of us who were stuck at home, not being able to do anything. But your other colleagues didn't seem to highlight any of the issues that we are speaking about. It's only the same people who we depended on, like yourself, to highlight the issues. I mean, what do you think should have happened differently? I mean, there's a women's caucus in Parliament, right? I mean, there could have been a lot more of leadership when it came to the issue of women. So this was a time to demonstrate the concerns, but it didn't seem that way. It seemed very isolated. What would you have done differently?
I think that I agree that there has to be better coordination, particularly those working on the ground, the NGOs together with the parliamentarian and also state assembly together with the federal. But because of the change in the government unexpectedly, we were stuck in a situation where cooperation tends to be very tense or politically charged. That I hope that I wish that we had cut across that. Secondly, is that yes, the gender caucus could have initiated a discussion, but on hindsight, yes, we definitely could have done better. The other thing is really the stimulus budget. The stimulus budget, in fact, I've been saying that, they have to be more transparent about the stimulus budget, because we only know that the big figure. We don't even know where the money has gone through, uh, because we never sat in parliament to actually even understand or have a black and white to show us, where have the money been spent. I really wish that, they had actually consulted the parliamentarians before they even implement the stimulus budget. Even though they may say that, it's emergency and all that, but subsequently parliamentarians cross party could have been put together one team, and I have been suggesting put together one cross party team to actually look at what needs to be done. You can have one on health, one on the care economy, one on distributing the looking at security. At one point, there was this big worry about the agriculture sector not being able to provide enough food for the population. So you could have MPs, forming caucuses or groupings, to talk about that. But it didn't happen. It really didn't happen. And I hope that, we don't want another crisis like this, but moving forward, let's have a cross-party discussion.
Let me ask a frank question to both of you. In the discussions coming from the MCO and today, where we are at the RMCO, are women represented in the committees that have been formed to actually deal with the COVID-19 repercussions, the impact, and so forth? Because when we had the Asian tsunami years ago, one of the things that we noticed was that the committees that were formed at the local level, when they were made up of only men, they highlighted different issues. But when women were brought on, they highlight things like welfare, health, sanitation, which men didn't really highlight. So it's been years since that period. And today we are in a situation where we are yet again facing another crisis. Are women there in those committees that are making decisions concerning the COVID-19 crisis?
Well,
Your opinion?
Oh, sorry.
Irene.
I think during this period, what we are seeing is that the number of women in leadership seems to be decreasing for whatever reason, but certainly women in leadership has decreased over the last 3 months in ministries, in committees. The number of women in the political parties, the number of women in leadership has decreased. Yeah.
Maria, picking up what Irene just said there, we're seeing seemingly a dwindling commitment in this particular government to having women in leadership. Local government, you're seeing women slowly being replaced by men. Head of regulatory bodies, even entities which work on sexual reproductive health, like LPPKN recently, where it's now replaced with a man who's a chairperson. Why do you think this is happening? Especially, why is it that women whose voices are critical to addressing issues that men frequently forget about, are they being left out? What should happen instead? And most importantly, I ask you as a member of parliament, what are you as a leader in the community doing about it?
Well, I think that if you look at the present cabinet, how many women are there? I dare not even count. Less than 5, right? And that is a big indication of what the importance that the leaders actually place on women's leadership. The political parties play a huge role in making space for women. They don't do it so well. I think that also the training at the political party level don't actually focus so much on what are the particular needs of women candidates as compared to men candidates, they are different to some extent. Right? Some needs confidence building, some needs resource building, and so forth. And the party has to start looking into this kind of issues if you really want more women to participate. Yeah. The other thing is that I wish that there are some. Well, during the time Empower, we used to have we used to train women to be candidates, whether at the state level, JKKK level, or at the federal level. I really hope that the NGOs will pick this up again to really look at how we can actually push women candidates forward, and perhaps even support some of the women candidates in the general elections that's going to come. I mean, Irene and I, we started with the women's candidate initiative. We got involved and all that because we had a very good candidate at that time. That kind of initiative needs to be revived again because we really need to push women's candidacy. It's not that we don't have women. We have plenty of women who wants to stand. It's actually fighting for the opportunity and the positions. And maybe we need to put up independent women candidates and and try.
But one of the criticisms that's often been leveled at activists, especially, that when they become candidates for public office, is that they don't represent enough people. Like somehow or another, you're supposed, like if you're talking about women, you have to also be able to represent the voice of women from the B20 all the way up to the top. And this is something of a challenge that's always leveled towards people, especially women candidates. And do you agree with this requirement that you are able to represent, every strata of the community that you're supposed to represent?
But which men candidate actually do that?
Exactly. Indeed.
Indeed.
It's a double standard here.
Yeah,
And certainly,
they always put funny criteria on women and not on the men.
But let me ask you, Irene, we are missing out the voices of women from those who are unable to voice out their concerns, the women migrant workers, those who are in the less privileged categories, the low income households. I mean, when you have political rallies or you have rallies, they cannot afford the time to go out there and express support. They can't expend the time to be able to voice out their concerns or express themselves. How do we mobilize them? How do we get their voices into the issues that we need to be able to address? Because we know what happened during the COVID-19 crisis period. We know what the gaps are. Now is really the time for people like Maria to help address them. How do we get the voices of these women up to that level that we need?
I think if there is political will, we can organize women for political participation. For example, in India, the government actually organized the women's leadership at village level. Well, this is something that can be done, it's doable, but do we have the political will to push it? So there are many ways in which we can raise the voices of women, but we need the space to do it. I think many NGOs are prepared to help in this kind of effort, but we don't have the space. All village leaders are men, and that's it.
So how would you want to change this, Maria? I mean, we're depending on a government today who is a little bit uncertain as to where it is politically, and there is some space to work with them to change or push forward some of the reforms that were introduced by the previous government. But today we're not that sure exactly where that space is. How would you open up a dialogue? Both of you have emphasized the role of NGOs, and perhaps a partnership with NGOs could be a way to move forward, especially in increasing the voices of women. Would this be something that you would want to help develop at the parliament level?
I think that at the parliament level, instead of just depending on the present government, I think maybe the NGOs can play a bigger role, and young people can play a bigger role, because bear in mind that the next election we have really increase in voters in the vote bank, with more younger people, 18 and above, are able to vote. So these would be our future leaders. I would rather put my eggs in those baskets rather than just focusing on and hoping that this government will give more opportunity to the women. We need to encourage more young people. I mean, the virtual parliament is a good start. I hope that women are well represented there as well. But it's a good start. And we have to actually work together to encourage more young people. And if I may say so, if you look at Thailand's example, Future Forward, they are totally young people. So that's a case that we can actually, review and give us some hope, that maybe in Malaysia we may be able to do that.
But Irene, Maria is talking about tomorrow, the future. But the economic realities of today are hampering and even stunting the growth of this country, especially when it comes to issues affecting women. If you were to talk about resiliency, because today's topic really is about whether we are regressing or resilient in the way we look at the realities faced by women. I mean, half of what you just said just now seems to imply that we're regressing in terms of how we look at these issues that are affecting women. I mean, how would you want to ensure that there is a better today as opposed to the future that Maria is talking about, which is great and certainly is necessary, but that's tomorrow. How do we address the issues today?
I think something that's right there on our plates is jobs. We need to create jobs for people, especially those in the lower income bracket. We need to create jobs. So how are we going to do this? I think we need to put a lot of thought into this. We cannot depend on the former kind of economics. Not just the foreign investors will come here, or they will include us as part of their production chain, and then we can give jobs to thousands of people. And this is where many of the women are. But it looks like production is not going to be like that anymore. So in Malaysia, we need to think about how, if the women in the electronics factories and all these big factories are going to lose their jobs, how can they be re-employed? We can't think like the very developed countries which are looking at the science and looking at production by robots or this kind of things. We don't have that kind of technology here. So we need to think about how the ordinary person can still be economically engaged.
Okay. And this is both for the formal and informal sectors together, rather than depend solely on the formal.
Yes.
Maria, you came into office, in public office, with a background of social work and activism and a certain amount of understanding of that world. Do you think that future candidates for office to be members of parliament or ADUNs should also have, as part of their CV, experience in working in the areas of community work, as it were, in order to improve on the delivery of services that we expect from MPs?
I think not just being involved in the community, but having a right framework, a human rights and also a democratic framework. I think that is very important because you have to link the community, the right to food, the right to shelter, the right to health, and so forth, the right to even enjoy life within a human rights framework. Otherwise, then you will just be so-called giving fish instead of giving the fishing rod. So
Okay.
I think that people need to really understand the human rights. Um,
Uh, Irene, what do you think a candidate should have? You have the final word. What do you think your MP should have?
MP definitely should have greater involvement with the community. He should understand what is democracy. He should understand uh, what is human rights. I think these are basic fundamentals for any parliamentarian.
Okay. I think that's a great way to end our session this evening. Thank you, both of you, Irene and Maria, for being great guests this evening. I know a lot of people enjoyed the discussion that we had, and I wish you the best in your work helping those in the community who are most in need.
Thank you.
Thank you, Azrul.
So, ladies and gentlemen, that ends this evening segment. Please tune in to the Bahasa broadcast with my colleague Farah Osman at the same time on Thursday night, where we continue this conversation with Azura Nasron and Dr. Vilashini Somia. This is Azrul Khalib signing off. Good night.